Workforce Advocacy and the Nursing Shortage by Abby Alexander. Workforce advocacy. In today's modern healthcare system, nurses are faced with multiple issues in the workplace. Many different people are affected by these issues, such as the nurses, the patients, and the organization in which the conflict takes place. In order to be successful professionals, nurses and other staff members must be able to recognize conflicts or issues that take place, and they need to know where they can seek help in the workplace to resolve any issues. The American Nurses Association, also called as ANA, has worked together with its state's affiliates to advocate for professional nursing and patient care. One of the most important focuses of the U.S. healthcare system is improving the safety of patients seeking this healthcare. One important way to improve healthcare safety is to improve teamwork between staff members. The Workforce Advocacy Ecosystem Model was designed by the American Nurses Association to help individual nurses be able to self-advocate in their personal and professional environments. The 5 opportunities and challenges for advocacy programs recognized by the American Nurses Association is staffing, workflow, personal and social factors, physical environment, and organizational factors. Staffing refers to any job assignments that the nurses may get, such as the volume of the work assigned, the professional skill required for the job, or the duration of experience in a particular job category, and their work schedule. Workflow design pertains to the on-the-job activities of the healthcare workers, which includes interactions among the workers and the nature and scope of the work. Nursing shortages and how they affect the workplace. The profession of nursing has dealt with cyclic shortages for many years. Currently, in 2019, we are considered to be in a nursing shortage. There are many different factors and causes for this nursing shortage. Some of these causes include: currently, there's a 16% increase in job opportunities. However, the high demand for nurses is not reaching the need, and there are not enough jobs being opened, and not enough nurses applying for these jobs to meet the high demand. There is also a limited room for new students to enroll in nursing school. This is due to a small amount of instructors. Therefore, if there are not enough instructors to take on clinical students, then they can only set a certain amount of number to go through nursing school and graduate. Challenging work environment also discourages nursing students from finishing school and can cause current nurses to want to quit their jobs if they think the stress would affect their personal lives. The Essentials of Bachelor Education for Professional Nursing Practice provides the educational framework for the preparation of professional nurses. Skills in quality improvement, leadership, and patient safety are necessary to provide high-quality health care. Essential number 2, basic organization and systems leadership for quality care and patient safety. Essential number 2 is the essential that most likely correlates with workforce advocacy. These 4 bullet points are ways that nurses can promote workforce advocacy for their workplace. This comes directly from the essential number 2 from the BSN Essentials. The overall goal for the Quality and Safety Education for Nurses, also known as QSEN, is to meet the challenge of preparing future nurses who will have the knowledge, skills, and attitudes necessary to continuously improve the quality and safety of the healthcare systems within which they work. The 2 QSEN competencies that I chose that correlate mostly for workforce advocacy are teamwork and collaboration and patient-centered care.